Hi, my name is Natalie and I'm a speech-language pathologist. You've selected this clip because you're concerned about your child's speech. In this video, I will talk about specific speech sound delays and disorders. I will also tell you about how we can work together to help your child. It's natural for children to make mistakes when they learn to say new words, like walking or running. Learning to speak is a motor task. It takes time to develop and master. When speech errors continue longer than expected, a speech-language pathologist can identify speech errors and set up a treatment plan for your child. In many cases, children can have two or more of the following challenges. Some children cannot pronounce specific speech sounds. It is common for them to replace a more difficult sound with an easier one. For example, a child who cannot say the F sound might say pun for the word fun. A child who cannot say the K sound may say tup for the word cup. These errors are usually sound-specific, consistent, and predictable. Some speech sound errors are patterns that children use to simplify speech. They may change the structure of a word or shorten it. For example, a child might leave out sounds at the end of words. The word boot becomes boo. The word house becomes how. This happens even though he can pronounce the T and S sounds correctly in words like to and soup. Sometimes one sound can influence another sound in a word. A child might be able to pronounce the T sound in words like to and hot, but this sound is replaced when the word has a P sound. For example, the word top becomes pop. The word pet becomes pep. Unlike the first two examples of speech delays, some children have difficulty with their speech because of a motor planning speech disorder. The brain has difficulties coordinating movement of the lips, jaw, and tongue. In these cases, children have difficulties producing sounds as well as moving from one sound to the next. They often depend on special techniques to imitate sounds and words correctly. In this clip, I will talk about two different types of motor planning speech disorders, specifically dysarthria and childhood apraxia of speech. The speech of children with dysarthria is affected by changes in muscle tone, muscle paralysis or weakness, and can be caused by neurological impairments like cerebral palsy, stroke, or muscular dystrophy. Childhood apraxia of speech is another motor speech disorder. Unlike dysarthria, this is not caused by muscle weakness or paralysis. In most cases, the cause is unknown. Children with a motor speech disorder know what they want to say, but cannot get the words out clearly. They may have limited speech sounds. Their words are difficult to understand, and they often rely on gestures, facial expressions, or vocalizations to express themselves. Their speech sound productions may be inconsistent and effortful. They may also find it hard to control the rate, pitch, and volume of their speech. When setting up a speech therapy session, a speech-language pathologist will consider your child's age, his ability to attend, and his speech errors. Songs, books, and toys will be used to help your child attend, participate, and imitate sounds. A speech-language pathologist will also show you how to use a multisensory approach to help your child correct his sounds. This includes visual cues, verbal cues, and tactile cues to help your child imitate sounds correctly. Early identification and treatment can help your child make better progress, so please contact us if you're concerned about your child's speech development. We look forward to working with you and your child.